one of the things is that the therapists that we're using to do our studies are pretty focused on doing the studies. And so we have a sort of a limited set of people that we feel comfortable about training others. And so we only now are training people that we think are going to be working on our clinical trials. So we don't have any kind of broader training programs, at least at the moment. However, we are trying to put a lot of materials online. And so we have our treatment manual online, which is worth reading, I think, to describe the therapeutic approach. We're developing interactive online educational materials that will include some of the videotapes of the actual MDMA sessions with crucial moments that illustrate points of our therapeutic method, and those will be available. We are trying to explore setting up a phase 3 MDMA PTSD site here in New York City, and so we'll be looking for therapists for that. Training the therapists is going to be an essential part of what's going to be required by the FDA. Once these drugs become medicines, it's not that they're like the normal drugs that anybody can prescribe them. Only those people that have been through the training program will be able to prescribe them. And at least right now, because of controlled substances, only physicians can get the Schedule I licenses to prescribe. But that doesn't mean that the physicians need to be the ones doing the therapy. So in our Boulder study right now, we're purposely, the principal investigator is a psychologist. The psychiatrist works for the psychologist. And the psychiatrist comes, gives the MDMA, and then leaves. We don't even have a doctor on the site. And we don't even have 2 psychologists. Now we have a psychologist and a student trainee, usually, that's learning how to do the method. We've just finished a 7-day training program in Charleston, just finished yesterday. And we're supplementing that with a week-long, 5-day actually program where therapists come and get MDMA one day and placebo another day in a therapeutic setting to learn how it feels from the inside out. And I think that's going to be an essential part of the training, that the therapists will learn a lot more once they've had their own experiences in that therapeutic setting. But we are thinking, as we start moving towards the phase 3 studies, that we're going to be wanting to train quite a large number of therapists. And there's another program which the FDA has, is once you're starting to do your phase 3 studies, if you have a waiting list, if you have a serious or life-threatening illness for which PTSD is, and you have a waiting list for people getting in phase 3, you can apply for what's called expanded access, which is the same as compassionate use. And in that context, patients can pay for their own treatment. And you're observing safety but not efficacy, because it's not double-blind, because everybody's going to get the MDMA. And so hopefully we will get that in about 2.5, 3 years, and then we're going to train a whole bunch more therapists for the compassionate access. So I think right now there's a little bit of material on our website, and we're training very limited people, but it will grow over the next couple years. And by the time that we're maybe a year or so away in 2020, if our schedule is right, and we make MDMA into a medicine in 2021, starting in 2019, 2020, we're going to be wanting to really train large numbers of therapists. So there will be opportunities for people to learn.
And I will add, I told a nurse who talked to me after my talk, like to get some unofficial experiences to be a Zendo volunteer, actually. You know, so applying some of that stuff that's available online in practice in sort of, you know, of course, non-official settings, but nonetheless, I think could be worthwhile.
Raven Ray at the Citadel is coming up with a project called the Aftercare Project, and our goal is to create a website where people who have had difficult experiences in the Amazon with ayahuasca can receive aftercare and then get referred to therapists who can help them get further in-person treatment if they need it. So the project is currently in development. We're working to get some funding for a extensive website. But right now we have a Facebook page. So if people are interested in that, I think there's going to be a lot of opportunities to monitor the the forum so that if people are coming with questions, that there's somebody who has some experience that can help them through like that initial sort of getting to know you and find out who they can be referred to and that kind of thing too. So that's another potential opportunity in the future.
There is one question that have been kind of bouncing in my mind for the past year, and that is that comes from our experience in offering ayahuasca to a patient. If, in fact, psychedelics are substances that we can treat as a regular medicine in which you prescribe for someone to treat a condition. And the reason why this is bouncing in my mind is that for us, it's very difficult, for many of the patients that join our study, it's very difficult to convince that individual that as it was not really his choice to look for us. We did an active, and we have to do it, we did an active movement of recruiting people and asking these people to join a lab and to take a substance that they have never taken. And that, as we all know, it comes with a very different experience that they have never faced it before. So my question is, if we are at a certain stage in which we cannot prescribe that, and we have to wait for these subjects to look for a alternative treatment by informing, society of what these substances are. So this is something that I really didn't reach a conclusion or something that says, yeah, I think you should do it, because we have been treating ayahuasca in the same way that, as a psychotherapy. That's the way we have been using ayahuasca, understanding that ayahuasca has a psychotherapy power on itself, on the individual dealing with himself, so him being his own psychotherapist. And when you prescribe a psychotherapist to anyone, that's, every psychiatrist prescribe a psychotherapy to a patient, that patient has the opportunity to, in the middle of the session, he just walks out the room. And that's not the case with psychedelics. I mean, a lot of our patients, in the middle of the sessions, they go like, can you take me out of here? I don't want to be here anymore. So it was not, at first they did not look for us. They did not look for that experience. And it's very difficult to tell these individuals that, you have to let it go. But what is it exactly, let it go? Let it go to where? Who am I trusting? So, this is something that I want to raise. It's a very naive thing, but, I just thought that, that is something that's bothering me. I don't have an answer to that. So I was just wondering if I could have a feedback.
This isn't weeks or months or years of cognitive behavioral therapy. And this is something that is vastly out of the scope. I mean, the data that you presented earlier on how many people consume these substances it is small compared to other drugs of abuse. It's small compared to other therapies and other pharmacotherapies. And it's a really different paradigm. And I think that's something that a lot of people here understand, but we're also a very small proportion of society. And what I think is really helping in this, at this phase in our evolution of this medication, is the fact that there's so many news outlets and popular media outlets that are so graciously giving sober and kind of as objective as possible coverage of this. And I think that's an incredibly important part of this, but I think that part of the answer to your question is that just educating individuals on, educating society about what the potential of this therapy could be, about what the pros and cons. I mean, this therapy is also not for everyone, right? I mean, no therapy is for everyone. SSRIs are certainly not for everyone, and part of the answer to your question, I think, is education, continued sober and objective, non-sensational coverage in the media of what this is and how this can help people, and then just buy-in and more research. Shameless plug here, more research. So give us more money. No, but yeah, and I think your answer is somewhere in there for me at least.
We have so many people that want to be in our study. They're seeking us out all the time. Right. And they have very limited options for alternative treatments that maybe have already failed for themselves. So our challenge is, how do we expedite drug development as quickly as we can? But then bunches of people were like, how can I get help now? What do I do now? I've exhausted the SSRIs. They don't work. These other psychotherapies are re-traumatizing. And so our dilemma is, some people have actually, gone out and found MDMA on their own and looked at our treatment manual. And there's actually a tremendous video on The Verge called Ecstatic States. It's about a 12-minute video, and it's about a Vietnam vet who heard about our research, decided that he didn't want to spend all the time and trouble to get in the study, but he lived near a college campus, and he thought, I'll just buy MDMA. And then he talked to his therapist at the VA who wasn't able, and unofficially she worked with him, and he got better. So I think the challenge with MDMA, as different than ayahuasca or psilocybin, is that MDMA, of all the psychedelics, is the most inherently therapeutic. And we hear stories of people that use it and heal themselves without even therapy of certain things. So our dilemma is, what do we do about this vast flood of people that need treatment that don't know what else to do?
There's also getting started psychedelic integration therapy. And so there's going to be an event around that here in New York next month, November 12th. And if you know Ingmar Gorman, who is helping out with Horizons, he can say more about it. But for the people that do sort of take the unofficial path and then kind of need help afterwards to integrate and to go further and work their problems, that's hopefully it's a service that's starting, and it will be hopefully expanding, and there will be maybe opportunities for practitioners to be involved. There's obviously practical things you can do, but I'm sure you figured them out already. There are, dangers to being out there talking about your personal use. I think we're kind of teetering on the edge of a moment here with our psychedelic community, where we have sort of a mass number of people that are ready and willing to do that, and we just need to find the way to give an outlet for that.
Yesterday, Rick said, public opinion regarding medical marijuana changes when people know that their grandma or their sister or their mother get relief with medical marijuana. So I think my view is that the same thing has to happen with psychedelics. So you do need to some degree, stand up on the rooftops. But by the rooftops, I mean like Thanksgiving dinner, and say, hey, Mom, hey, Grandma, I know you guys have noticed that I feel better about myself, that I'm eating more healthily, that I exercise now, that I have a girlfriend who's not crazy, and all those things. And all those, the reason why I'm inspired by those, what has inspired that is that I, ate 5 grams of mushrooms in silent darkness last month, right? And whatever they think, unless they're crazy, they're not gonna, especially if you're still normal and still well-adjusted and you're not, running naked through the streets, they're gonna be like, oh, well, he does seem like he's more healthy. He does seem like he's a better person. I'm not sure if I want him taking mushrooms or not, but maybe I'll be willing to learn more now that I see that there's a positive effect in his life. So that's what I think everybody here needs to come out to their family. As much as it might seem difficult, as much as you might feel like you're going to be judged, come out to your family, because I can attest that coming out to my family about my psychedelic use has been the #1 most transformative experience of my entire life. And I think that it can be the same thing for all of you as well. And you don't need to have a website where you're telling the world that you do psychedelics, but just tell your family, tell your sister, tell your grandma, and let them know why you're a better person.
The most important thing about ethical research is informed consent, and people volunteer. Actually, there was a Canadian general that had PTSD from UN-related work, and we tried to reach out to him, but he wasn't interested. So I certainly think the idea of working with your emotions can make people choose mediation and negotiation over violence. And to the extent that generals want to volunteer, that they're welcome to do it. But I think that it's not just psychopaths at the top. You know, they have popular support. So what we need to do is really change attitudes in tens and tens of millions of people so that they don't give power away to people that do things that we think are better left undone. So I think that's really the long-term strategy, and that's what I see happening with the spread of ayahuasca throughout the United States and throughout the world, and this sort of psychedelic consciousness, I think, to embed it, not so much in changing a few people at the top's minds, though that's important, but I think we need broad-scale, more spirituality, and I think that's what we're all trying to bring about.
If you think about the way that mushrooms are traditionally administered in ritual contexts in Mexico and peyote and et cetera, it's a really profound thing to think about the differences that may occur in terms of context of a natural environment versus, for instance, a room in a hospital in Baltimore, right? The one piece of information that I do have is we've conducted online surveys with thousands of respondents, and we've compared ratings, for instance, on the mystical experience questionnaire that we collect in our experimental laboratory studies, and we've compared this mystical experience questionnaire between laboratory studies and this online survey, and it seems like people are experiencing mystical experiences to the same degree, maybe even at the same rate in terms of people that report these experiences, and we haven't found any evidence. This isn't quite published yet, but we haven't found any evidence that there are differences between responses we've gotten in the survey and responses that we've gotten in the laboratory. But of course, it begs the question: if we were ever given permission to do such an experiment, I think a lot of people would jump on that opportunity.
I'll add one thing, which is that we need to monitor temperature, we need to monitor blood pressure, we need to do a lot of things to assure safety. And after we've done a certain number of patients like that and we've demonstrated that we don't really need to monitor these things anymore, then there's a little bit more fluidity. There is a breakthrough sort of that we've made. We've found out that with the DEA, they're willing to give permission for research outside of institutional settings. So for our study that's MDMA for people with life-threatening illness with anxiety, we've got permission to do it at the psychiatrist's home. And it's up a long road up on Mount Tam in California, Northern California, and you go through redwoods, and then he's got this long deck surrounded by nature in his backyard with a hot tub out on the back. But it's taken us a long time just to get to that. But the sessions will be indoors. And one of the things that I learned from Stan Groff that was really surprising, because I've had this concept that it's got to be inside, your eyes are closed, you're wearing eye shades, you're listening to music. And what they said at Spring Grove is occasionally when people would have really difficult LSD experiences, they would go for a walk with them. So that is possible. And the most extreme example, I'll say, is the study that we did with MDMA with cancer patients at Harvard at McLean, and it was the first subject, and he was going through a lot of anxiety. He was a military guy, never taken anything before, and his wife he'd nursed for years through cancer. She'd died years before, and he had a girlfriend, and she was watching with me in a control room watching the therapy, and he got so anxious that the therapist thought, well, maybe if his girlfriend came in, and so they shut off the camera, and she sort of cuddled with him for 5 or 10 minutes, and he totally calmed down, and then she left, and then had this transformative experience. So I felt like we kind of smuggled love into a clinical research setting. And, but I do think that outdoors, there's a lot of things that are not controlled, and that it's going to be a long time before we do that kind of, if ever, research in an outdoor setting primarily.
In Brazil right now is that the Ministry of Justice has just approved a couple of projects, a couple of scientific projects to have alternative treatments for addiction. The Ministry of Justice is financing these 7 projects. And in one of them, the individuals, they will be randomized to either go to a hospital setting to go for a double-blind experiment just like the ones we are conducting, and the other individuals will go to UDV, so in a different setting. And so that maybe will have a complementary answer to the type of question that you're asking.
The context is more powerful than the... And the idea that if everybody just takes psychedelics, they'll have these unitive experiences, I don't think is true. I would say that because of the tradition of Roman Catholicism and the fact that ayahuasca, a lot of the religions had to find their way under highly repressive circumstances, they're kind of syncretic religions, you know, the classic forms, and I'd be curious what you're saying, but they're homophobic, they're patriarchal, they're very hierarchical. So I think it's really about the context that we create more than about what drugs are available. But I do think that the findings that Roland Griffiths and others have found about openness, that there are certain personality changes that do seem to go along with psychedelic mystical states. And so I think there is some reason to hope, but I don't think we should be so naive to think that all we need to do is make access to psychedelics in whatever context, and that'll somehow make the world better.
We're very new at understanding this stuff, and all these indigenous cultures, you know, have been working on it for a very long time. And there's the medical, scientific aspect, which is, you know, I'm so happy that that's seeing the light of day and having tremendous benefits. But there's also maybe hidden dimensions to this stuff in terms of, you know, what, you know, occult traditions talk about. You know, there may be all sorts of things happening that is going to require a whole other level of sophistication and development for us to fully understand. Might take a while.
We do tend to idealize the experience. I think that looking at the ayahuasca culture in the Amazon proves that drinking ayahuasca or psychedelics in general does not make people holy. It doesn't make them more like sort of, you know, altruistic. In fact, you know, in the Amazon, ayahuasca is power. So it's power that can be used to heal people. It's power that can be used to throw psychic darts. It's power that can be used to make someone's life miserable. So it's, you know, psychedelics are power. They're not necessarily, you know, it's not necessarily the hand of God that's going to make you a saint. And I have an ongoing conversation with a friend of mine, Lily Ross, about whether or not psychedelics actually change people. And I'm inclined to believe that when I look at just like people around me, is that they give you the courage to be the person that you are already. And, you know, when you're a person who is already, if you're a liberal, if you're, you know, already want to be a person who's environmental, you want to be a healthy person, you want to care about other people, it gives you the freedom to sort of slough off the parts of the culture that tell you that's not what you should do, and you start to do it. But, you know, like Neil was saying, Charles Manson, whether it's a sorcerer in the jungle, whether it's, you know, giving Hitler psilocybin wouldn't have like ended World War II. It would have just increased Hitler's Messiah complex, I think.
We may not want to give psychedelics that weight, that responsibility. So
Right.
just building on what you said, like, because I can take you out any weekend in New York or anywhere else and show you people taking MDMA or other psychedelics who are not evolved and not healing and not whatever. And like sometimes that's okay with me. Like it's all right if they just want to have fun and enjoy the experience. You know, I don't need them to do all of their personal work like right now or right then at that moment. And you know, if we want them to evolve in certain ways or like take certain lessons about how we need to change, you know, our relationship with ecology or our families or whatever, it doesn't necessarily need to come as a result of their psychedelics use. It's like what Neil said, it's suggestive, it opens us up, you know, but I don't think that psychedelics need to necessarily be like the causal factor.
Bill Richards, who's trained me in a small way and has some really incredible insights to psilocybin and psychedelic experience. He gave me the analogy once of recreational use of psychedelics was like kids playing marbles with diamonds. And I really kind of, given the experiences that I've seen, you know, in the 28 sessions that I've guided with psilocybin, it's far less than he's done, but I've truly seen that. It's a tool. And it is something that can help you to move into a direction. I think this might actually apply to the question previously too, but these are tools, and the context in which you take them is important, and the intention with which you take them is important, and the work that you do afterwards is important too. So it's dose, it's context, it's intention, and it's constantly, I mean, our lives are work. You know, we have to strive to be good humans, and we have to strive to grow, and it's not about the drug, it's not about the substance, it's about the experience and what you can do with it. And I think that applies to life in general as well. I just kind of wanted to tack that on to the end. Thanks.
I just want to, say the counterpoint to that, which is like, wouldn't it be fun to play marbles with diamonds? Like, that sounds awesome. So that's just, I'll just leave it there at that.
And I guess I'll add that I think a lot of people really do have really profound spiritual experiences at these electronic dance music festivals and things. And so there is kind of a denigration of recreation, and it can be broader than that. But I think what Bill is really pointing to is that if you just have a very limited set of ideas, like I'm just going to do this for fun, then you're setting yourself up for problems, because a lot of deeper things can happen. But I think you can have deep things happen in a group, communal, celebratory kind of context.
Don't discount or discredit like the spiritual use of psychedelics. I think that's a really important thing here. And I've seen, I had a very close friend who was he's a veteran of Afghanistan. He was a drone pilot. And when I first met him at an ayahuasca ceremony, he was ready to commit suicide. And he said we were sitting around talking before the ceremony. He said, "I don't really care what happens tonight. If I die, I'll be fine with that. I'm just suffering so much." And then in the course of that evening, I had a very challenging experience, and he helped me. And then I asked him to tell me a story. I said, "Tell me a story about being a soldier." And he told me about what had happened to him that night. And he said that the most traumatic experience that he had as a soldier was he was flying his plane remotely, of course, and he saw the target, the person that he was supposed to shoot, and he pointed the camera at this guy, and the guy heard the plane and looked up at the plane, and my friend made eye contact with the guy through the camera, and he pulled the trigger, and he saw the guy explode. And he said, that person, because I made eye contact with them, personified every person that I had eliminated with my plane. And he said, tonight he came and he appeared to me. He said that the ayahuasca said, "I have someone here who wants to meet you. Is that okay?" And I told her yes. And this guy appeared, and he said that he forgave me, and he said that it was okay, that he was in a better place. And then he had a vision of this person that he had killed and him in their next incarnation. And they were brothers. And they went to a psychic to get a past life reading, and the psychic told them that they had been enemies in a battle in their previous life, and the idea seemed so absurd to them, they just laughed and laughed and laughed and laughed. And he said that just the laughter and having this person forgive him, now him and his wife had a baby. He went from working at a position where he basically like cleaned out the vats in this chemical lab, because that was really all that he could do. And now he's like a day manager at this factory. He's got things together. He has a child, and things are really good. And so therapeutic, amazing things can happen in a spiritual context.
It's my sad duty to bring our conference to a close.